ages. In fact, our medications that we take would be that we reacted to it, and it's what just make us lose consciousness. We see many people on medications that are not regulated. So it's either that it's too much or too small. Somebody is diabetic and will go hypoglycemic and collapse, or is not taking it well, hyperglycemic will collapse, so that will be coma. Somebody hypertensive might not be taking drug and suffers a stroke, and stroke has different modalities of presentation, including loss of consciousness in some people, and it might be too much, the BP will drop too low, and the person would collapse. In the bones, we experience injuries that will also contribute to all these problems. People suffocating when there is bomb, even in the kitchen, when we are cooking, some use firewood. Even the gas that we use, sometimes they may react to it, and many people, some are allergic. It can be within the house or even outside the house. Some people might drown, and there are many reasons that could make people collapse. Basic life support is essentially around what we say sinking. For the lay persons, A, B, C, D, our airway, oxygen that goes in and the carbon dioxide that returns. So what is it about our airway? If it gets blocked at any time, and the person that is fainted might just be that the airway is blocked and is not able to exchange good air, and that will just keep it going down, and the person gives up. The person might stop breathing, and we don't know what to do to assist the person. It might be the heart that, I said A, airway, B, breathing, then C, cardiac or circulation. So it might be around the heart. It might be that the person is losing blood away, and these days we just use video to be recording rather than stop the bleeding. If we cannot give blood as lay persons, at least we should be able to stop the bleeding. And then the D is around drug and other things. So what I will be demonstrating are the basic things. We have children convulsing, that rather than we assist those children, we just make them go down. We have people that are epileptic and many other things that are there that will regularly kill people if we don't take the necessary measures. So what I would want us to do, anybody that has collapsed or fainted, there are certain things we need to do. Is this person arousable? Or don't let me start with that. Anytime there is a collapse or there is an accident that calls for immediate attention, one thing, the very first thing we do is clear the scene. Make sure that there is no further danger and we are not endangering ourselves. Somebody that got electrocuted is home to the shock and we want to pull him, which will get electrocuted. Somebody that is suffocating in smoke area, we need to take off whatever that is responsible for the smoke or extricate the person out of the place rather than stay within the place and continue to do the thing. We are also endangering ourselves and further compromising survival of the person. So the first thing to do is remove danger. Make sure that everybody is free from danger. The next thing is this person arousable? So we can call them hello, 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 so that we are waking and see if is alive, and then we can also confirm when somebody has collapsed, it means their heart is down. So usually when you come to the hospital, this is where we feel for the position of the heart. It's just the three fingers that we place around there. You can use a single one, but you may not feel it outright. But in the case of shock, this might be too faint for you to. So if you watch faint, many times when people collapse, where they go to is there. It's just between that muscle that is there and our voice box. So we place our finger there to feel if there is pulsation there, and we can shout because it's unfortunately some might be deaf. So even when you shout, they cannot hear you and they are alive. So we need to look for other measures to ascertain that they are alive. So we feel for that and call for help where there are no persons. Rather than we crowd around the person, we should give room for those that are able to provide assistance to the person. So that is what we should do. So the person is lying the back down, and for the airway, all we need to do is ensure that the jaw is raised so that it's open. So that it is opened. Just let it be open and the person can breathe in and out. That is the simple thing to do. Just the jaw lift. That's all that the person needs. And at least the person can breathe. It's only in some cases maybe they are, well, we don't want to say the person is alcoholic or is in deep stupor, that the tongue can now drop in the airway. So the jaw thrust might help, or we may need to, or the chin lift might help, or we have to do a jaw thrust to bring up. The moment you pull up this, it will take the tongue away from the airway and the person can breathe. So we can see the movement of a chest up and down, or we can put wick there, cotton wool wick, and you can see that the person is breathing in and out. So that's the simple way. If the person has vomited or has something within the throat, we're going to talk about somebody that has is stroking from aspiration of foreign body. So that is a different matter. So if the person has anything within the mouth or in the throat, we'll make an attempt to just scoop it out so that the airway is there. The first thing is airway. Gas, oxygen must be going in and out, otherwise the person keeps going down and will die. Ordinarily, within the first minute, if we are able to address that, there is absolute recovery. In the next 1 to 4 minutes, there might be some cardiac and brain reactivity that will make survival less. So, if it is 10 minutes and above, the person is dead without having oxygen. But we can be able to resuscitate with some brain injury out between 4 and 10 minutes. But if we're in the golden period, 1 minute, maximum 4 minutes, we're able to attempt to resuscitate the person. So that is about, so we clear the airway, we maintain the jaw lift. Then we ensure that the person is breathing. If the person is not breathing, what we do and the way it's recommended, especially for the elderly, many of the time is a sudden heart arrest that happens, and the way it's recommended, we start with the heart, the airway, and breathing carbon. That is what is recommended. So the next thing to do, the person is lying here on the flat surface, and we just do this to our hand. In the center of his chest, that is where our heart is. The heart is not on the side that we usually say is there. It's in the center. So we should be aware of that. So we just clamp the hand, and the heel of our palm is what we place in the center of the chest. And you can see my position. The hands are locked. My elbow is straight, and I'm standing right over the patient. So straight down is what I do, and I do that pressing it down for about 2 inches down and out, and I do it at a rate wanting to achieve 100 in a minute. So if I have done that in 15 seconds, I can quickly come to provide gas for the patient. So Sharia may be talking about mouth to mouth. Your target is reviving a patient, making somebody to be alive. So in that moment, we may have to neglect so many things. Then some people are worried about, what if the person is having a disease? How will I put my mouth to that person's mouth? If there is no open wound, you are covered. If there is nothing you saw that could also bring to you, maybe the person aspirated a poison or something, you are covered. But if you know that the person has done that, there are other means or ways which may not be readily available to you, maybe during emergency situation. So you can, but let's talk about the basic thing. So you just go and do that. I brought this is not everywhere. You just go and within a second you push through, and you see that the chest will rise, and you continue again. You don't wait for more than 10 seconds to continue this, and you do it. By the time you have counted 30, the rate I said is 100. By the time you have counted 30, you come, give, and you continue. You go, and you continue. So that is for getting the heart to come back and also ensuring that you push there. It's only when you have this available, which is not readily there, and not to make mistake of how to apply it. That is why I have brought it. This is the face mask, not the one we use to protect ourselves. So this is the nose bridge that is there, and this is for the chin. So we apply it like that. We talk about the C and the E. This is E shape. So the C is to hold this down, and the E is to lift the jaw. So we apply it like that. And if we have this available, where we don't want to do mouth to mouth directly, we can also put it. But if we have a ample bag, we can put that on the mask and do that. And if we have an assistant, that person can continue doing this. But oftentimes, all you need for the gas to go in is just 2 against 30. 2 against 30. So you allow the person to continue to do the cardiac compression in the center of the sternum, and you wait. He does that 1, 2, and you continue again. And by the time you have done 5 cycles, as recommended, because the person doing this might get tired. If you have an assistance, you can change. You keep doing it until help comes. You know, I said, ask for help. Unfortunately, we don't have paramedics. So we are the ones to help ourselves at this time. So if we learn this, we are serving at least as the immediate responder while we get help and assist the person to survive. I think
I want to just put further basic things into it. If we time ourselves now and we say, hold your breath, not many will be able to do it for 1 minute. That is the meaning of 1 minute is a very long time if somebody is not breathing. Right? Except the person is trained, maybe swimmer or somebody that is into breathing exercise, and there are not many in the populace. That is one. Two, calling for help. Even if you are in the market, somebody can have a contact of a doctor or a nurse or somebody or an hospital nearby. Such is the help. And ensuring that the environment is clear. If the person drops in the middle of the road, don't say you want to start resuscitation there. Move him or her out of that place, okay, to the side, so that an oncoming vehicle will not crush both the patient and the person trying to rescue the patient. It is very important. And if you have an assistance, it must be coordinated. Okay? So, yes, even if there is ambulance or if somebody is able to provide the breath, so somebody must lead giving the instruction. When I do this 30 times, then you do this twice. When I do this 30 times, not that as he is doing the act, the person is doing it between execution. It has to be organized. And even if this is the only thing we know, right, it is better to give this to anyone that needs it than to do nothing. To do nothing means the person is collapsing and then they are videoing and posting to social media, right? To do something. If it's only the chest you are compressing and you are not able to provide it's still something. You have called for help. Maybe among those help, somebody will go and say, let's do this as well. And then you are doing it. And finally, somebody can come with an ambulance to move the patient to the hospital. Assalamu alaikum.
We want to thank the coordinator of this program, our presenter today, Prof. Deeply appreciative. It's unfortunate that this we are looking at what he has done this morning. I paid 30,000 naira to under equal to be able to be taught about this. So, and the only person probably is not, it cannot happen. People have fainted in sujood. We are in sujood and the person has fainted. And he said there's no help. But in developed countries, especially China, a 5-year-old child can do this. 5-year-old. And the same thing happens in places in America or Europe. So it's first responder, it's everybody that should be able to master it. So we take this lesson from Prof and we try and really cascade it to people that are not here today. We are trying to make a video recording and post on the platform so that other people can benefit from this morning instruction. Assalamu alaikum.
I want to join others in thanking Professor Lukman Abdurrahman for this beautiful presentation. One common mistake that we do when people collapse is that we attempt to sit them down. It's absolutely wrong. Let them lie flat. Let them lie flat.
It is when they lie flat that it is easier to attempt to resuscitate them. Secondly, I want to indulge Prof, that maybe after another month or two, we should repeat this. Those of us that have witnessed this today, we should attempt to teach others. Very important. Every one should be able to do CPR, Cardiopulmonary Resuscitation. Every one of us, because you never know where it will happen or where the need will arise. Then, but that's okay.
What about those people that pour water on people themselves?
Also,
Water.
you don't want water.
It's just a crude way of thinking because they don't know what else to do.
One also when that is exercising is conscious, when he started feeling having shortness of breath, what should he do? And he cannot breathe very well.
Okay.
And he's conscious, maybe he's exercising also.
You should just relax. That's the first thing. It means you are going beyond your limit. So you should relax, find a place to sit down or lie down, and the person will recover. Rather than keep stressing yourself and want to do. And then exercises are in graduation. You do get to a limit, relax, and then you can build on it. Than to say, I must get to whatever level the first time or the second time.
Just like you said, exercise has graduation. The exercise of a professional athlete is different from ordinary people. Maybe when we take the issue of lifestyle modification, we will discuss exercise in great detail. But ordinarily, if most of the exercises we do are for two reasons. Primarily to strengthen our hearts. Okay? The second one is if you also want to, part of weight loss measures. But the primary one is to strengthen the capacity of the heart. And what the cardiologists advise is that when you do your brisk walk, the moment you start panting, you should just stop. That's when to stop. Two things, either you start panting or you start bringing out sweat. Okay? So it's not supposed to be a strenuous exercise. Okay? And what is most beneficial is when it is the regularity of the exercise. That is the one that is really beneficial. Thank you.
My question is, for how long could one continue to do this chest compression? Till when would give up? Assuming the person is not responding as expected.
Even in the hospital, we don't say you should stop, except it's confirmed that the patient is brain dead. So you keep doing it. If you are doing the correct thing, it's expected the person will recover, except the person has suffered some damage, but you are not doing it right, the person keeps doing that.
So what's the sign that we will see that will make us know the person is brain dead?
You are not an expert to confirm brain death. So I wouldn't teach science.
Sorry, sir. Maybe what he wants to know is,
Yeah.
maybe when can you say you want to stop? Like that, similar to what he has. Right? He has to just keep doing it. You are expecting help. we are expecting. If you are tired and somebody can assist you to continue it before the help comes, the help can be professional that will be able to tell you, or may be scared for him or herself to announce that the person is there. Just let's go to the hospital. And when they get to the hospital, they give the judgment.
Let's say Professor فإن لم تجدوا ما تكافئوا به فقولوا جزاكم الله خيرا. Whosoever does good for you, that people appreciate the person. You can appreciate the person in kindness, do that. But if not, say جزاكم الله خيرا. We say جزاكم الله خيرا to everyone. It is only Almighty Allah that can reward you, and we pray that He rewards you abundantly. As a person, I appreciate you as a learned a lot this session. Almighty Allah to reward you abundantly. SubhanAllah, mashallah, that's Assalamu alaikum wa rahmatullahi wa barakatuh.